Hello, my name is Sam. I am a counsellor and a midwife, and I'm the founding member of the Counsellor Midwife. I'm here today to talk to you a little bit about postnatal depression. So, postnatal depression is a little bit of a confusing term because mental health issues that manifest in the postnatal period aren't just depression. They can manifest in many different ways. Before I come on to talk about postnatal depression, I just wanted to talk to you a little bit about the baby blues and the baby pinks. So the baby blues are what we refer to as a normal, hormonal, emotional reaction to when you've just given birth. So after you've just given birth, you have a lot of hormones leaving and you have a lot of hormones kicking in. So this tends to peak at around 3 to 7 days postnatally. You might find that you're crying a lot, that you feel very hormonal. This is a really normal reaction and is absolutely nothing to worry about. So just ride it out and go with it, and rest assured that around 80% of women will experience this. So the baby pinks are the opposite really. It's where you feel a real intense feeling of happiness and elation. And it's all to do with the hormone oxytocin, which you release in flood loads after you've had your baby, and that can just make you feel like you're in this sort of like what we sometimes call the baby moon, where you just had your baby and you're in this glow of lovely happy feelings. So if you're somebody who has maybe experienced bipolar depression before, or you've had episodes of mania, the baby pinks can be a little bit scary because it can feel sometimes like a manic episode. So if you have had experience of bipolar or manic depression, it's certainly worth checking out how you're feeling with your GP or a mental health professional just to check it out. But if you've got no history of this and you feel this elated feeling, that is absolutely fine. A little bit like the baby blues, it peaks at around day 3 to 7 and then those hormones just settle down. So now to talk about postnatal depression. So postnatal depression can manifest from around 6 weeks up to 12 months postnatally. So if after you've had your baby, you're starting to feel like you're really struggling to get out of bed, you're lacking in motivation, it's more than feeling tearful, it's having a very low mood. It can also manifest as anxiety. So you may be feeling super anxious, you may notice that you're becoming hypervigilant about things. Some women develop some compulsive disorders, such as hand washing excessively or washing the baby's things excessively. Some women will develop paranoia, where they feel like everybody's watching them or judging them. And then other women have sometimes what we call a postnatal rage, where they just feel uncontrollably angry. So if you're experiencing any of these things and it's lasting a while, it isn't just passing like I've explained the baby blues or the baby pinks do. It's really important that you get some medical attention and you speak to a healthcare professional. So the people that can help you, because usually your midwife will have discharged you by now, is either a GP or a health visitor. Talking therapies are really, really important to people who are experiencing postnatal depression. So it's really good if you reach out and get some counselling. It's incredibly helpful. So if you'd like to find some counselling, you can check us out on the counselling directory, and you can also find me there. Thank you for your time today.